Recently, we have seen a significant attack on the rights of transgender people, especially trans youth. 2022 was the year with most anti-trans legislation introduced in history, and 2023 is already on track to beat that record. There have been about 100 anti-trans bills introduced this year so far. There have also been various right-wing attacks on transgender people. Right-wingers and fascists are claiming that transgender people are grooming children into being transgender and should not be exposed to children. In November, the Club Q club was shot by a fascist attacker. There are 3 types of anti-trans bills occurring right now. They fall into the categories of medical care bans, drag bans, and don't say gay or trans bills. There are twice as many bans on healthcare as there were last year. These bills ban surgery, hormones, and puberty blockers below a certain age, or forcibly detransition youth. Some bills go up to age 18, others go up to age 21. However, Oklahoma has proposed a bill written to ban gender-affirming healthcare until age 26. This has been changed to age 18. The ages keep getting higher and higher, and some far-right individuals have called for banning healthcare for trans people at any age. Some states are trying to ban insurance from covering trans healthcare. Texas proposed a bill that bans insurance providers from providing gender-affirming care, which is a de facto ban for any transgender person who isn't wealthy. Some bills have targeted healthcare providers, making it so that they can be sued by anyone who regrets surgery or transition, which will make them less likely to want to provide the care. Texas lawmakers are targeting parents and defined providing gender-affirming care for children as abuse. It would require parents to be investigated by CPS. This means parents will either have to stop getting their children health care and harm their mental health, or risk having their families separated by the state. Or if they can afford it, they can move to a different state. Gender-affirming care involves medically transitioning with hormone replacement therapy and sex reassignment surgery. Children do not medically transition. Until the age of puberty, they only socially transition, which means they get new clothing and a new name. Around age 8 to 13, they may be given puberty blockers, which will delay their puberty in order to give time to make sure they are actually wanting to undergo a different puberty. Hormones are given to teens typically at around 16, and surgery is almost never given to anyone underage. Many transgender adults never undergo surgery at all or have to spend years saving for the cost because they are not covered by insurance. Right-wingers claim that trans adults are grooming kids into sex changes, and this has no basis in reality. Transgender people are more likely to experience mental illness, depression, and suicidal thoughts or behaviors. Both medical and social transition decreases dysphoria and improves mental health. Family acceptance decreases suicide risks significantly as well. Bans on drag. Ban drag shows as being ban them as being inappropriate for children and an adult activity, or ban them in schools and libraries. At least 9 of these bills are being proposed in the United States right now. An Iowa bill would criminalize bringing children to any drag show. An Arizona bill would ban monologuing in drag as part of a performance. And this ban could be worded, this ban is so vague that it could be wielded against any transgender or gender nonconforming person speaking in public could technically fall under a crime. This could ban trans teachers speaking to students or trans people speaking at protests and rallies. These bans on drag are vaguely worded so that anyone wearing clothing not aligned with those made for their sex assigned at birth could be targeted. Transgender people are people who identify different from the gender assigned at birth and often medically transition, while drag is a form of performance art that involves costumes, usually men dressed as women. Drag performers typically take off their costumes and resume identifying as their assigned sex when they are not in performance. However, bigots do not care about this distinction or even know about it, and often confuse drag queens and trans women, making an attack on drag in public an attack on transgender people, particularly transgender women. There are also Don't Say Gay bills. The first Don't Say Gay bill was passed in Florida in 2022. These bills prohibit discussing LGBTQ topics in schools, usually in kindergarten through 3rd to 4th grade. Some are banning up to 12th grade. Missouri has a bill that would ban all discussion, with the exception being that parents must approve. The erosion of trans rights corresponds with the erosion of abortion rights, bodily autonomy, and the rights of women. Gender policing is a tool of the patriarchy to maintain male power and oppression of women. LGBTQ people do not conform to patriarchal norms around gender or sexuality and are marginalized and demonized in various ways as a result. Transgender people are marginalized even greater due to gender nonconformity being very visibly outside of the norm. Trans people should have the right to gender-affirming surgery and hormones, name and gender changes on documents, and the right to dress any way they please. The right for transgender people is tied with the right for bodily autonomy for women. The history of transgender people involves being criminalized up to the 1970s for cross-dressing. This changed during Stonewall when the police attacked the bar and the queer people in the bar fought back. LGBTQ people have historically been persecuted and criminalized And this riot spurred a large demonstrations and direct action and the gay pride movement. Before the gay liberation movement started in the late 60s and early 70s, gay, lesbian, and transgender communities were completely underground. Laws banning drag are reminiscent of pre-Stonewall days when people were arrested for cross-dressing or for dancing with people of the same sex. Queer people have gotten increased visibility and acceptance in recent decades. And Democrats have helped with legal struggles toward marriage equality. They have added LGBTQ+ rights to their platforms. Transgender people now have greater visibility in media, but never gained significant public acceptance. Trans rights are being attacked currently, and Democrats are barely mentioning it. Rights that have been given to us can be grabbed back. In order for queer people to have liberation, we must fight back with other oppressed people against capitalism.